Welcome to another podiatric medicine video of mine where I am performing a nail surgery for an ingrowing toenail on this big toe. The toe is already injected and numb, and I begin work. The tourniquet is placed on and this prevents bleeding. This is most important when we are performing a phenolization of the nail bed, as this part of the procedure does not work if the patient is bleeding. It also means we can see what we're doing better. As you know, I've separated the nail plate from the surrounding tissue, made the relevant cuts with the nippers, and use a small scalpel to complete the cut into the nail bed without cutting the skin, and this means we need no sutures. Once this is done, I can remove the two edges of the nail. We clamp them on remove them in a small twisting movement, which should remove the whole nail, a whole piece of nail without it breaking. Occasionally they do break, especially if the infection has been present. And in cases like that, we would have to find the small nail spike left. It is also always important to check that no nail is left. As you can see, I'm doing this here. And there is indeed a small piece of nail left behind in the medial bed here. And it's important to get that. This is one of the reasons why a phenolization may not be successful. We do not want to leave any nail plate behind, as this will prevent the phenolization of the nail bed from being successful. It's important to make sure there is as little blood as possible still in the wound before we begin phenolization, which I'm about to begin now. This part of the procedure does help to limit some of the bleeding, but also gives a very high probability that the ingrowing toenail will not return once the patient is healed up. The two primary risks of nail surgery, aside from nail regrowth, are infection, and this is a risk to weigh up, as risk of leaving an ingrowing toenail in situ is that it almost certainly will become infected, and on the day of the procedure there is a increased risk of bleeding. We have a large dressing. Patients are advised to non-weight bear as much as possible, and we tend to avoid the use of non-steroidal anti-inflammatories on the day of the procedure, and if analgesics are needed, then paracetamol is advised. It's reassuring that most patients post-procedure do not need analgesics, and of those that do, most only need one dose of paracetamol. Once the phenolization has been completed, it's important to remove the tourniquet, as this would be a serious complication. It's important to ensure that the circulation returns to the toe. As you can see, the toe becomes pink, and then we can begin dressing. I prefer to use this Countersat dressing underneath sticky dressing, and this helps to limit the bleeding, which, as I see it, is the most significant risk of the day of surgery. The wound needs to be well protected, and this bandaging does help to limit the bleeding. Usually I will have patients remove their own bandages within 24 to 48 hours after the procedure and begin their wound care regime. Usually most follow-ups for most healthy and able patients are done remotely every 2 to 4 days. If infection is noted, then prescription for antibiotics is issued. But this procedure has a very high success rate, something in the 95 to 97% success. If you like this video and want to see more, please subscribe to the channel and give the video a like.